The other thing I want to touch on is the difference between therapy skills and interviewing skills. Child therapists needs to know how to work with the child in developmentally appropriate ways. However, child therapist is not an interviewer and does not need to know the details of what happened to a child, should not be asking the child what occurred. A therapist needs to ask a child what happened. They're not understanding how to work with play therapy. Children will tell you what happened through play. They should not be asked questions around this. Even very young children can provide reliable forensic evidence. I'm talking about children 2.5 years and up, but they need to be interviewed in a developmentally appropriate way by interviewers who are specifically trained in how to do this. Children are not adults. They cannot be interviewed as adults. And this is a very specific skill set. The point I want to make is that interviewing young children requires very specific training. Training that consists of how not to ask leading questions. What is a leading question? A leading question is a question that invites or presupposes certain answers. The interviewer has to communicate with the children in developmentally appropriate ways. This is a huge topic. There are some university courses in this area. Dr. Yule has done some good research in this area. But it's important to know that if children are sexually acting out, do not interview the child, do not ask the child questions. Simply record what you notice and take the child into a competent child therapist who is trained in this specific area and who can ascertain what's going on for the child through play therapy. If child welfare, the police need to be involved, then they can conduct the interview, which is a different skill set, and hopefully they have the specific skills to do that with whatever age child they are doing an investigation with. I think it's critically important that we nip these behaviors in the bud before they become problematic. I have worked with adults who did not receive therapy as children and, where they have continued to act out sexually. No child wants to grow up to become a sex offender. And most of these children, even without treatment, won't. It's prudent for parents and caregivers to educate themselves, to find therapists that they feel confident with, and to ask many, many questions, and to expect their questions to be answered. Thank you very much, and have a good day.